is recognized.
Madam Speaker, H-Res 52 provides a closed rule for consideration of H.R. 2, the Children's Health Insurance Program Reauthorization Act of 2009. I really am honored and privileged to have the opportunity to present this rule to the body. The rule provides 1 hour of debate, equally divided among and controlled by the chairperson, minority member of the Committee on Energy and Commerce, and the committee and ranking minority member of the Committee on Ways and Means. Madam Speaker, the S-CHIP Reauthorization Bill of 2009 is a fiscally responsible way to revive our commitment to providing America's low-income children with the quality health care they need and deserve. The bill authorizes $32.3 billion over 4.5 years to cover the 7 million children who currently rely on S-CHIP and extends coverage to more than 4 million low-income children who are currently living without health care. The bill offers comprehensive and wide-ranging care that includes mental, dental, prenatal, and maternal health services. The underlying bill also supports a multifaceted approach to increasing health insurance enrollment. It provides states with incentives to lower the number of uninsured children and authorizes $100 million in grants for new outreach programs in schools and community-based organizations. Additionally, the bill fights geographical health disparities by offering additional support to underfunded states that meet these enrollment goals and improves reporting on state health conditions. Lastly, this bill has provisions that ensure that S-CHIP prioritizes children who legally reside in the United States. The bill prohibits new waivers that would cover parents or phases out S-CHIP coverage for parents and childless adults and includes measures that prevent payments to unlawful immigrants. Madam Speaker, when all 50 states, the District of Columbia, and 5 territories, and perhaps the 6th, the Northern Marianas, now that they're included, gave children access to health care under S-CHIP, our government exemplified our nation's commitment to equal opportunity. S-CHIP has prevented millions of low-income children from suffering under our country's flawed health care system for over 10 years. And adequately supporting and expanding this valuable program is even more imperative during these hard economic times. Madam Speaker, the 2008 financial crisis exacerbated our long-standing health care crisis. Last year, skyrocketing gas and food prices and the plummeting job market made it difficult for low and middle income, indeed for all Americans, to finance their everyday needs, importantly including health care. In a country where a large portion of people receive health care insurance through their employer, it comes as no surprise that when the economy and job markets plunge, the number of uninsured Americans soars. And children frequently pay the highest price. Even prior to last year's economic crisis, the number of children who depended on S-CHIP and Medicaid was increasing. Madam Speaker, the facts are clear. 1 in 9 American children are uninsured, and this issue hits close to home. Florida was ranked 45th in the nation in terms of overall health. Like other low-ranking states, Florida has a large uninsured population and a high rate of child poverty. In fact, Florida has the 2nd largest number of uninsured children in the country. Although these statistics are inexcusable, our current president's failure to address the alarming number of uninsured children in this country was and is an outrage. The president committed an egregious action, in my opinion, against our children when he repeatedly vetoed the bipartisan S-CHIP Reauthorization Act of 2007. For many states, the annual funds allotted to state S-chip programs were on the verge of depletion, and the welfare of millions of children depended on whether Congress and the President would agree to adequately finance S-chip. President Bush's actions sent a devastating message. The leader of the free world was willing to put the lives and welfare of millions of American children at risk. Now, in this new Congress and with a new administration, power, the political will, and the opportunity to make a different choice. Like-minded Democrats and Republicans and independents understand that fighting the epidemic of uninsured people in this country is a fundamental component of restoring our economy. We know that S-chip and other health care programs decrease costly emergency room visits and invasive medical procedures. We know that extending health care insurance helps to combat the social, economic, and health disparities that continue to divide our nation and hinder our progress. And we know that healthy children are better equipped to compete in school and help America compete in the global market. Simply put, we cannot have a healthy economy without healthy people, and this must begin with our children. I urge the adoption